Did you know that between 20 to 45% of heart attacks are silent? That's right. When you think of a heart attack, what comes to mind? Most people imagine something dramatic, like in the movies, someone clutching their chest, struggling to breathe, and suddenly collapsing or something worse happening. But don't believe the movies. It's not always like that. A silent heart attack can have subtle, minimal symptoms, or even none at all. Yes, it may sound strange, a heart attack happening without the person knowing, but it's true, and that's why it's called a silent heart attack. We know that heart attack is the leading cause of death in the world. In this country, cardiovascular diseases kill about 400,000 Brazilians per year, according to the Brazilian Society of Cardiology. And less than 5% of the Brazilian population knows how to recognize the symptoms of a heart attack, the number one cause of death. Let this sink in and take care of your heart health. Don't wait for symptoms to appear, make healthy choices today. Is a silent heart attack different from a normal heart attack? Well, both have the same underlying cause, but what differs is the symptoms, or lack thereof. The heart is a muscle that needs oxygen-rich blood and nutrients to continue its functions, which is pumping blood throughout the body. In a heart attack, or myocardial infarction, there is a blockage in the blood flow in one of the arteries that supply the heart, the coronary arteries. The buildup of fatty deposits inside the arteries, atherosclerosis, is the main cause of heart attacks. The person already had a fatty deposit that for some reason ruptures. Maybe due to stress, cold, intense physical activity, or exertion, something that pushes them over the limit. When the fatty deposit ruptures, platelets, which are part of the blood, try to stop the bleeding, resulting in the formation of a clot. But since this is happening inside an artery, which is like a pipe, the clot will grow and block, causing partial or total obstruction of the artery, resulting in a heart attack. The heart muscle will suffer from the lack of blood. Remember that blood carries oxygen and nutrients to the muscle, and cells will begin to die rapidly. Depending on where the obstruction is it a main artery? The left main coronary artery? The anterior descending artery? Or is it a secondary artery? Is it at the beginning of the artery, or is it at the very end? All of this will determine the severity of the heart attack. And of course, whether you were quick to go to the emergency room or delayed your treatment will also influence the degree of injury. And there is the first important point about silent heart attacks. Since the person has no symptoms or few symptoms, they simply do not perceive what is happening. A silent heart attack is bad because it is less likely that the person will go to the emergency room and receive the necessary treatment, which is critical to prevent significant damage to the heart. Take care of your heart health, and don't ignore any unusual symptoms or signs. Be proactive and seek medical attention promptly to prevent the worst from happening. What are the symptoms of a classic heart attack? Not including silent heart attack, as I mentioned, according to cardiology statistics, less than 5% of the population manage to identify symptoms of a heart attack, so it is worth mentioning. Here are 7 classic heart attack symptoms. First symptom of a classic heart attack: uncomfort, not breast. This pain lasts longer than a few minutes, usually more than 5 minutes. It is an intense and lasting pain that can go and see. It may look like pressure, weight, opening, or burning. I'm sore because my heart muscle is dying. Imagine, if you're like a goat, and what's more, imagine a pain caused by a dying muscle. Second symptom of a classic heart attack: dor de radiação. In addition to feeling pain in the chest, the person may also feel discomfort in other areas of the upper part of the body. Dor or sleep in the left arm, fish, coasts, jaw, stomach, or both Kadaf Ellis. Classic heart attack symptom 3, lack of air and difficulty breathing. His heart is already suffering, it is not pumping direct. Classic heart attack symptom 4, cold sore and pale skin. Your body, due to pain and discomfort, will have a wave of adrenaline, and you will have that cold and sticky sweat and you will be pale. Fifth symptom of a classic heart attack: nausea and vomiting. Nausea and vomiting are due to a reaction of the vagus nerve. Sixth symptom of a classic heart attack: dullness. This nonsense can lead to fainting. Seventh symptom of classic heart attack: anxiety. Due to the surge of adrenaline, you will feel anxious, with that sense of impending doom. What are the symptoms of a silent heart attack? The biggest problem with silent heart attacks is that if there are symptoms, they are often mistaken for less serious health problems. This confusion increases your risk of dying from coronary artery disease. A silent heart attack may not cause chest pain, numbness, or shortness of breath. To be clear, a silent heart attack can be without symptoms, with minimal symptoms, or unrecognized symptoms. According to the American Heart Association, Of the over 800,000 heart attacks per year in the US, about 170,000 are silent heart attacks. That's a huge number. A silent heart attack carries a higher risk of some complications. Heart failure. Since they don't seek medical attention, the heart attack damages the heart further. A person who has had a silent heart attack has a 35% higher risk of heart failure. Stroke. Those who have had a silent heart attack have an increased risk of stroke because clots may form due to heart dilation, in addition to increasing the risk of atrial fibrillation. Risk of another heart attack, as they may not have realized they had one. In fact, people who have had a silent heart attack and are unaware of it have a 3 times higher risk of dying from coronary artery disease. And because of all this, there is an increased risk of sudden death. A 2018 study found that about half of all survivors of a silent heart attack died within 10 years of the incident. What are the risk factors for a silent heart attack? The same as for a classic heart attack. Anything that causes atherosclerosis. Smoking. Diabetes. High blood pressure. Overweight and obesity. Sedentary lifestyle, lack of physical activity. Cholesterol, both low HDL and high LDL, the bad cholesterol. Elevated lipoprotein A. Inflammation. Age. Women in menopause over 55 or men over 45 have a higher risk of a heart attack. Family history of heart attack and stroke. Of all the risk factors, I have to emphasize diabetes. Why? Diabetes silently attacks the nerves in the body. That's why people with diabetes are at risk of feeling tingling in their feet, or even not feeling their feet. But it's not just in the feet. Diabetes can also attack the nerves in the heart. That's why diabetics are at higher risk of having a silent heart attack. The pain they should feel, they simply don't feel. It's like their heart is anesthetized. But what is pain for? It serves as an alarm. Without the alarm, they don't know they need to rush to the hospital. What are the 6 signs and symptoms of a silent heart attack that are ignored? Again, the symptoms can seem so mild and so brief that they are often mistaken for discomfort or another less serious problem and simply ignored. Don't ignore them. First symptom of a silent heart attack. Fatigue. The person may feel tired or physical discomfort, an undefined malaise, and think it is due to overwork, lack of sleep or even age. It may not be. Women may think they have a passing virus. If you have those risk factors that I just mentioned, fatigue may be being interpreted in the wrong way. Don't make a mistake. Go to the emergency room for an ECG and cardiac enzymes. It could save your life. Second symptom of a silent heart attack, mild discomfort in the chest. I mentioned that a classic heart attack has a strong pain. Those who have it don't forget it. Most silent heart attacks involve a mild, subtle pain or discomfort in the center of the chest. In the center. The person thinks, it's gas, or it's heartburn, reflux, indigestion. If you feel that something is not right, you need to be evaluated by a doctor in the emergency room. Third symptom of a silent heart attack, sweating. If you are sweating, without being too hot, without exercising, it is odd, you must remember that it may be a silent heart attack. And you should go to the emergency room, especially if you are diabetic. Fourth symptom of a silent heart attack, shortness of breath. If you suddenly feel like you just ran a marathon, but only climbed a few stairs, this may be a sign that your heart is not able to pump blood to the rest of your body. And in a silent heart attack, shortness of breath can occur without chest pain. It's something common. Especially in women. What we call a disproportionate shortness of breath to effort. Maybe that alarm symptom. You may also feel dizzy or lightheaded, and it's possible you may faint. Fifth symptom of a silent heart attack, nausea. The person may think it's a simple indigestion or virus, or even the flu. But nausea can be a sign of a heart attack, especially if you are sweating profusely, with discomfort in the chest or fatigue. Sixth symptom of a silent heart attack, discomfort in other parts of the body. Again, a mild discomfort, different from the classic heart attack, in the jaw, stomach, neck, a pressure on the back or feeling like there is a rope tied around it. Do not ignore these 6 symptoms. Seek emergency medical attention. I have several patients who came in for a routine checkup for some other reason, and when I look at their ECG and ask them when they had a heart attack, they smile, thinking I'm joking. And when they go for other tests, there it is, the heart attack. The electrocardiogram showed an area of scar tissue, fibrosis, and therefore, there wasn't much they could do to prevent the loss of that heart area. Of course, it's important to identify why this happened so we can treat it correctly, investigate what's behind that silent heart attack, but it's always better to identify it before having one, or even in the moment it's happening, through an electrocardiogram and cardiac enzymes. I know you may be thinking, it's difficult to recognize a silent heart attack because the symptoms are vague. And that's exactly it. Bonus tip for you. How to protect yourself from a heart attack. First of all, if you have already had a heart attack, you are at a higher risk of having a second one. You need to see a cardiologist regularly and take medication. There is no way to avoid medication because if you have had a heart attack, a stent, or cardiac surgery, you need to take medication. Period. It's not magnesium chloride, coenzyme Q10, vitamin K2. None of that works. Treat it with what we have scientific evidence for because we have medications that will reduce your risk. Second, I have not had a heart attack and do not want to have one. Great. Can you reduce your risk of having a heart attack? How? Attack the risk factors. Half of heart attacks can be prevented with changes in some habits. For example, quitting smoking reduces the risk of a heart attack by 30%. Keep your blood pressure under control, 120/80. If you have diabetes, it is important to keep your blood sugar well controlled, with a HbA1c of less than 7. Eat well. What is the best diet? Low-fat or Mediterranean diet? This is a frequent question. In May 2022, a study was published in Lancet with more than 1,000 people who already had established arterial disease. Half of them were placed in a group with a low-fat diet, and half followed the Mediterranean diet. And what did they find? The Mediterranean diet won. The Mediterranean diet included more olive oil, nuts, and fatty fish, which are sources of good fats, healthy fats. After 7 years, those who followed the Mediterranean diet had significantly fewer heart attacks, strokes, and related problems than those who followed the low-fat diet. So, the Mediterranean diet. Is it expensive? Yes, it is a problem. But medication is also expensive. Reduce cholesterol and triglycerides, with diet and exercise, but if you cannot, there is medication. Exercise, at least 150 minutes of moderate physical activity per week. Sleep well, 7 to 9 hours per night. Lose weight if you are overweight or obese. Create new connections, make friends. We know that loneliness and social isolation increase your risk of a heart attack by almost 30%. And don't forget to have a cardiology checkup. Cardiac exams are becoming increasingly reliable. If you have a high risk of a heart attack and many of those risk factors, it's worth your cardiologist ordering more in-depth exams, such as coronary angiography, which shows how your arteries look from the inside. It's not for everyone, but for selected cases, it can save lives. Taking care of our heart health is essential for a long and healthy life. We need to pay attention to the warning signs and take action when necessary. By attacking the risk factors through lifestyle changes and medical treatment, we can significantly reduce the chances of having a heart attack. If you found this information helpful, don't forget to subscribe to our channel and leave your opinion on the matter. We would love to hear from you and continue providing valuable content to help you take care of your heart health. Thank you for watching.